Carly, thank you so much. Exactly 2 weeks from today, millions of Americans will head to the polls to choose their next president. Hillary Clinton has a healthy lead in the polls right now, but Donald Trump today seizing on a very big issue, rising health care costs. Scott McLean has more.
After well over a year on the campaign trail, the end is finally in sight. Election day is just 2 weeks away.
Get your friends, your family, your co-workers out to vote.
Donald Trump is in the key battleground state of Florida. Hillary Clinton is also in Florida, but has only one event. Perhaps that's because a new CNN ORC poll shows that nearly 7 in 10 Americans already think she'll win the election. But Donald Trump is not throwing in the towel just yet.
Obamacare is just blowing up.
Trump has found ammunition in a new government report showing Obamacare premiums set to rise an average of 22% for the benchmark silver plan next year. Trump claims the number is even higher.
That number is so wrong. That is such a phony number. You're talking about 60, 70, 80% in increases.
The average captures a wide variation among states, from a 116% jump in Arizona to a 3% savings in Indiana. Still, the rising costs are bad news for the Clinton campaign.
Am I happy about the latest news? No, none of us are.
Trump wants to repeal and replace the law. The Clinton campaign is defending it, promising it can be fixed.
Do we throw the baby out with the bathwater and start over with a non-existing plan that Donald Trump is talking about? That's absolutely crazy.
Clinton does have some room for error, holding a comfortable 5-point lead in the polls. Trump still insists he can win, but with early voting open and just 2 weeks left, time is running out. In Washington, I'm Scott McLean.
Now, I want to be clear about something. The government says that most consumers who use the Obamacare will likely see a price hike, or will not likely see a price hike, because 85% of enrollees receive federal subsidies. Here's Health and Human Services Secretary Sylvia Burwell.
For the 11 million in the marketplace, 85% of those folks actually have the tax credits or the subsidies that help them. And those subsidies are designed to move as premiums move. So for those folks, they will be insulated from those changes.
Okay, so let's go with that number. Let's say 85% of enrollees will not pay more for insurance next year. There's still the 15%, though, who will likely see those numbers go up. And that's where we begin to hear the stories of some people who can't afford health insurance. Health for All is a nonprofit here in the Brazos Valley that provides health care services to some low-income residents who do not have health insurance. Liz Dickey is the executive director for this. To be transparent, I am a board member of this organization, but I wanted you to come in, Liz, and talk about Health for All, because I think this is where this kind of an organization picks up the story from here for the 15% who maybe can't afford these health insurance premiums.
You're absolutely right. It is our mission to provide access to affordable health care for those who have nowhere else to turn. And Health for All is a local safety net for those citizens of the Brazos Valley who can't afford their portion or don't have access to employer-funded health care. Because the state of Texas did not expand Medicaid, there is a huge coverage gap of people who are not eligible for subsidies, and they're looking at a huge deductible if they do get a insurance plan through an exchange and can afford the premiums.
So when these headlines came out yesterday that said next year we're going to see premium hikes 22, 25%, Donald Trump says it's even more than that. When we look at headlines like that, so we're saying that a good number of people here in the Brazos Valley and the state of Texas should be concerned about this. The numbers, when you hear how many people don't have health insurance, give us some statistics here. How many people are we talking about really?
We're looking at closer to 1 out of every 4 people is uninsured in our region.
1 out of every 4?
1 out of every 4,
wow.
25%. And when you say Texans should be concerned, every Texan should be concerned, because the cost of the care for uninsured patients is passed on to taxpayers, employers, anyone who has a health insurance premium. It's going across the board.
So if this isn't you or your family member, you're going to end up paying for it somehow.
One way or another, this affects you.
Okay. That is where, again, I bring in Health for All, because this is an organization that then helps to pick up the needs and the services for those who can't afford the health insurance.
We do. We are a free clinic, so we don't refuse anyone for an inability to pay. And the way we do that is we use volunteer medical providers. So it's sort of a Doctors Without Borders where you can make it home in time for dinner. We have patients that have stories that, you know, they're working multiple jobs, they're single parents, they're just trying to keep their heads above water, and we're doing what we can to help make sure they can access primary care. The uninsured are up to 4 times less likely to have a doctor's office. They're less likely to get preventative care, and they're far more likely to die from something that should have been prevented. And we want to avoid all of that and the cost associated with it, as well as the health of our community.
And we stress that you're a nonprofit, so you depend on the volunteers, you depend on donations and funding from the public. And when you get news like we got yesterday with Obamacare, is there a concern that you're going to start seeing more people, which puts more work on the organization?
We are. We currently are struggling with the demand as it is. There is more patients trying to get into our doors than with volunteers coming in to provide services. So we absolutely need volunteers. We need donations. We need this community to rally together to take care of our neighbors in need.
When we have something like this in the headlines, we talk about how to help our neighbors, how to help our community. Well, this is one way. However, Health for All also needs help in order to help others. So there's the number, there's the address where you're located, the website. We'll put all this on kbtx.com. This is a to be continued story for sure, Liz. We certainly appreciate you coming in and talking about it.
Thank you for having
All
me.
right, yeah, thank you, appreciate you. And stay with us, we'll have much more coming up after this.